Our first panel we posed the question, what are some of the critical needs, opportunities, and trends in urban built environment, health, and policy? Not an easy question, but it's my pleasure now to introduce them to you so we can hear what they've come up with. Mark Nieuwenhuijsen is an internationally recognized leader in environmental health. He's the director of Urban Planning, Environment, and Health Initiative, and the director of the Air Pollution and Urban Environment Program at the Institute of Global Health located in Barcelona. Esra is a health data research fellow. She's in the School of Public Health at Imperial College, London, and she works intensively with imagery and machine learning for the Pathways to Equitable Healthy Cities project. Antonio Gomez-Palacio is a partner at Dialogue, an urban design firm in Toronto, and he's been instrumental in developing the community well-being framework for urban planners. And finally, Cory Neudorf, he's the lead academic medical health officer for the Saskatchewan Health Authority. He's also president of the Urban Public Health Network, which is an association of the medical health officers in 24 of Canada's largest cities. So I'll ask each of you to provide about 10 minutes on your top picks for the question, and we'll start off with Mark.
Many thanks, Eleanor, and it's a great pleasure to be here. You can hear me?
Yep.
Okay, great. I prepared a little presentation that I'm getting a bit older and forget things, so I thought I'd make it a bit easier for myself. Many thanks for inviting me to give a few thoughts. I mean, it's a very large topic, so I just quickly put a few things together what I thought may be relevant. Of course, there are many more things to consider, but first of all, I would like to congratulate you. I mean, it's wonderful to see that this platform exists, the data that's being produced, and also the research that's coming out of it. I mean, I think it's extremely important. I was a bit sad to hear that it's coming to an end, and I was hoping that you could keep going for the next 10, 20, 30 years, because I think we need to have more data. It's extremely important to build up evidence and inform our policies. Without data, without this type of platforms, it's much more difficult to do things. I certainly hope that you get further funding. I think I start with the premise that we have a fairly good idea, perhaps not a perfect idea, but that we know quite well nowadays that there is a relationship between urban design and all the different indicators related to that, how people get around, how this leads to pollution, etc., lifestyle factors, and also to morbidity and mortality. Kind of what is the current status, I think. You know, you can say, oh, we always need more information, this a little bit more, that a bit more. But, you know, overall, we've got a fairly good idea. Air pollution is bad for you, for example, you know. How much more do we need in that way? Or, you know, there are other things what you may have. But I think the question is how we're going to change this. So one of the things that I would like to highlight is the importance of interventions. We want to make things better in our cities, and so we need to have interventions and policies that are being implemented, experiments, or at the moment also what we see, the pandemic, what's going on. I mean, it's a good way of intervention, because we want to know, you know, if you intervene, if you try to make a city healthier, does it really also become healthier? So for that, I think what you need to see is that we need to have longitudinal data. I mean, that's one of the reasons why I'm saying I'm hoping that you keep going and that you can actually take into account the changes that are taking place. Of course, these interventions can be on a very small basis or on a much larger basis or area or something. What we see here in Europe, there's a lot of work going on in cities around nature-based solutions. So solutions to making cities better that mimic nature. For example, increasing green space. And one of the things what I'm seeing is there's a lot of evaluation going on. Now, doing an evaluation of intervention is not easy at all, because first of all, these interventions may not always take place when you want them to take place. They may be small, blah, blah. So there are a whole kind of issues around that. The other thing what is coming up is for the climate crisis, we see adaptation and mitigation measures. And I think it's there also very important that we conduct evaluation. And for me, that's kind of the, you know, a very important trend, a very important area of research that we should consider. I want to give you a couple of examples what I thought were nice. Actually, this is a study that just came out from Germany. They were looking over 100 cities, and for 20 of them they increased the cycling lanes in the city, and they wanted to know if increasing the cycling lanes in the cities would people to get more to cycle more. And what I actually found was that in these 20 cities there was 11.5 kilometer of more cycling lanes, of extra cycling lanes coming in, and that increased the cycling frequency by about 11 to 48%. I mean, so this is for me kind of an intervention, what's happening. And we've seen many more interventions with the pandemic happening that are very interesting, including reductions in air pollution, changes in how people visit green space and this, etc. That other things, what we see taking place in cities that are taking interventions in how in the use of the land use currently. This is an example from my own city here in Barcelona, is the superblock, so-called superblock. Currently we have the grid system that you see on the left. Probably you're familiar with it in your cities as well. Lots of motorized traffic. The idea is in the superblock to cut 4 junctions in a block of 9 and introduce more green space and active transportation, and so no motorized traffic. And the idea is, for example, in Barcelona to introduce 500 of these superblocks. We have introduced a few, but I mean, I know also other cities are introducing this kind of schemes or similar kind of the low traffic neighborhood or whatever you call them. Whatever kind of a similar basis, but it's important, I believe, that we need to evaluate this in terms of environmental exposures, but also in terms of outcomes. This is an example of the superblock in Sant Antoni in Barcelona. The top slide is what we had before, and then after the implementation of the superblock, where we see more green space and no cars and more space for people. Other things that are being introduced, probably you're familiar with, like Paris, the 50-minute city, where the idea is that all your destinations, work, school, etc., are within a 50-minute walking or cycling radius of your residence. Now, perhaps in Canada it may be a bit different because you have a different way of getting around or a different context. But I mean, I think this is also for how do we change people's behavior. And again, I mean, it's important to do some evaluation of what kind of influence this may have on environmental exposures, on lifestyle factors, etc. The second trend is, I think, for not looking at one exposure, one health, but looking at multiple exposures at the same time, looking at holistic approaches. You know, we shouldn't only look at air pollution, but at the same time, you see the noise, you see green space and temperature, etc. That all goes together. And I think too long we've been just focusing on one exposure, one health. Here in Europe, we have I think at the moment 9 so-called exposome studies. It's a big program of around 100 million euros that the EU is funding to advance this area. Myself, I'm involved in a couple of them. I just heard Jeff is also in Expanse there in the Scientific Advisory Board. I'm in that. I'm also in the Athlete Project. And this is some data from what we have from the Helix project, was around birth cohorts, 6 different birth cohorts in Europe. And we published quite a bit on this, you know, looking at multiple exposures, how this is then related to health, and advancing the field in this way. The third part is knowledge translation. You're doing already knowledge translation or have done so, and I think this is extremely important. I think we know already so much what is good or bad for us for health, but we don't act enough in a way. And we need better knowledge translation and also evaluate the knowledge translation. What is effective knowledge translation? What is actually needed? We need to work with stakeholders, see what they actually need and provide this information. Including, for example, quantitative health impact assessment. I'm involved in this myself quite a bit, where we look, you know, what is the current burden related to certain exposures, but also make future scenarios, what we can see, help planners to see what is the health impact of their decisions of what they would like to do in the future. Also, as what you showed, you need easy to implement tools. I mean, that actually can be used by others as well, including urban planners, transport planners, but for example, also the education sector. Here at IS Global, where I work, we have an initiative around knowledge translation, you know, bringing all the very complicated research that we have together in very simple language. And I think that's extremely useful. Also, we applied Utopia tools, health impact assessment tool for urban and transport planning, where we look at a number of different exposures and lifestyle factors, including physical activity, air pollution, noise, heat, and green spaces, and can predictions what is the current burden of disease, but also future burdens for different scenarios. For example, here in Barcelona, we use this and estimated that 20% of mortality in Barcelona is premature because of suboptimal urban and transport planning. This is extremely useful, of course, for the planners. And then the next is they asking us for how do you make it healthier? I mean, and so we can come up with different scenarios using this particular tool. As what you're also looking at, I think what you see in the urban and transport planning communities, they want to have a simple checklist often, or some indicators that they can use when new developments are taking place or retrofitting. What are the particular elements that make our environment healthy? And we know now quite a lot what are the specific indicators. So I think it's important to communicate this and interact with our different stakeholders. Here I've given a number of different stakeholders. I think it's extremely important that we go out, and you know, they're perhaps not always the obvious one. Also, currently we're working quite a lot with the education sector. I mean, I don't know if you have the same problem in Canada as what we have here, that a lot of kids are going to school by car, while they actually should be using, should be walking or cycling or using public transport. I mean, it's a very important intervention to give you know, kids independence, and also make our streets much safer. So that's something to think about. That quite a few of these ideas, what I talked about, I wrote a review not so long ago. You can find them here. You can read a little bit more about them. Happy to send you an article. And so these are the kind of 3 ideas what I came up with so quickly. I'm sure there are many more, and I'm looking forward to hearing from the others in the panel to see what they came up with. Thank you.
Hi everyone, I'm Esra, and first of all, thank you very much for the invitation. So as Eleanor mentioned, I'm a research fellow at Imperial College London, and I mean, over the past few years, my research has focused on using emerging sources of data and mostly imagery to measure the urban environments. So today I thought I'll try to bring in a data and tools perspective, and I hope it will be useful. So first, I wanted to start with some trends, and I think there are quite a lot of overlaps with Mark just presented. So the first thing was, I think what we consider as the urban environment relevant for health is getting broader. I'm relatively new in this research area, but most of the research, I think, so far focused on pollutants and chemicals, which are still very important and relevant for health. But along with this work, I think there are increasing numbers of people thinking about the built environment, green space, density, temperature, noise, and also things like walkability and playability and perceptions about our environments and their interactions and combinations and how they relate to pathways to health and disease. And second was changes in the data environment and the methods. So I see more and more researchers are thinking of new sources of data that can be used to measure our environments. And at the same time, new methods are becoming available. For example, in my work, I have been, as I said, working a lot with street level and satellite images, and I've been using deep learning methods, and a lot of others are also doing this. But we can also think about new data sources like from mobile phones, GPS traces, social media data, and other types of crowdsourced data that people are using in this space, and the methods that are being developed to be able to analyze these types of data. And the third trend that I wanted to talk about was an interest in understanding change in urban environments and how things change in response to interventions like policy, and also shocks to our system like COVID or climate change, but also more general trends like digitalization. And specifically, I think we want to have a multi-sectoral approach. For example, my background is in transport planning. So we want to ask questions like what self-driving cars would mean for our environments, or like if working from home will become common practice, what would this mean for our travel needs or where we decide to live, for public transportation, for disparities and for pollution. So those were the trends. And then when I was thinking about like gaps, challenges, and opportunities, I wanted to focus more on the data side and think about potential opportunities for a platform like Canoe. So the first one I really wanted to mention was data access issues. So again, as I mentioned, there are many research groups that I know of, also through Canoe, that are working with street level images and very high resolution satellite images to understand our urban environment. And one of the biggest challenges, I would say, is the access to these data sets, and because they are mostly collected and held by private companies, and the rules of use are often not clear, costs are sometimes very high. And when you look at using mobile phone data or GPS trajectories, again, there are a lot of issues around privacy, and sometimes companies own this data, so there are issues around data formats and what can be shared. So we end up spending a lot of time and effort just to understand if we can access and use these existing data sources. And I think a lot of parallel similar discussions are happening between the same companies and researchers. And I think there is great value in bringing together these companies, like the communities of producers and users together. And I think Canoe has already been doing this, but I just wanted to say that I think this is very valuable going forward. And I think if we can form a community with clear requirements and needs as users of these data sets, I think we can help reduce the barriers for using them more widely in research. And the second thing that I mean, this challenge and opportunity area I wanted to mention is on identifying common data use cases. So I wanted to share this figure that I really like from a paper that basically gives an overview of how people can use images and how they're using images for environmental measurement and exposure science. I think we do have, today I think we have quite a good number of proof of concept studies and papers that show the promise of using images. They're not solving all of our problems, but we agree that they are useful. So ideas summarized here in this figure, like object detection, segmentation, and also end-to-end training for different exposure measures were all tested in different geographies with different data sets. And I think there is broad agreement that we should try to make good use of these data sets. And I think we're at a stage where we can identify common problems as a community, where we mostly agree on that we need better methods and tools for. So I think there is a case for making data sets and organizing challenges as a community. And just to give you an example of probably more in the field of computer vision and machine learning, they were really successful in identifying common problems and tasks to be tackled and compiling the data sets as a community that they can share and test their methods on. And I think we're seeing similar trends now in mapping. So satellite data sets are being compiled for specific mapping challenges. And while these challenges are actually very relevant for this environmental health community as well, I think, but they don't really directly address its issues at the core. So I thought a platform like Canoe may bring together the research community for organizing similar challenges and data sets and help us identify common problems and tasks that we have from a data and tools perspective. And I think it will be useful to attract attention from the machine learning community, but also from the companies, because it makes them visible in these conferences that they actually value. So that was all from me.
So next up, Antonio, our urban planner.
Sure. Thank you very much, Eleanor. When I was first approached, with the question of what can you be doing in the future, I thought, perfect, just keep on doing what you're doing. It's awesome. But then they said, but you have to talk about this for 10 minutes. So what I've chosen to do here is pick 3 themes of things that I think we all as an industry need to be getting better at. Certainly kind of can think about, and I know that there's already kind of a lot in this direction, but frankly, all of our partners, all of the organizations that, occupy the space of health and built environment, and I truly believe that in a few years, we will continue to develop some thinking around some of these elements. So let me share screen here. The first one is the whole area of JEDI, right? Justice, equity, diversity, and inclusion. We've certainly seen through the course of the pandemic that there's a tremendous amount of data that is coming out that is demonstrating that a lot of the effects of the coronavirus are hitting people unequally. So this is a map of my city, so city of Toronto. This is where I live. And what would otherwise have been a virus that, arguably we are all equally susceptible to, in reality, we're not, right? So the lens of equity and diversity is one that needs to be overlaid on a lot of our understanding of much of how we perceive health and well-being, certainly when we start to look at differences between neighborhoods and communities and other impacts, right? So, the notion that income is a social determinant of health has been around for a long time, but in many regards, our ability to correlate economic factors, social factors, race, these other elements to health is only starting to kind of really increase in awareness, and ultimately I believe we need to get better at it. I already start to see, and many of you will have seen, there's a lot of understanding and even communication that is starting to emerge out in this area. So National Academy of Medicine is starting to even put out the notion that equity matters and that we need to be understanding elements of health and well-being in different ways, depending on the individual backgrounds of where people are coming from. So not sure where this space will take us, but clearly there's a huge call and impetus right now for us collectively to really start to take some of the tools and methodologies, the understanding that we have in what I would argue is a slightly more politicized way, when we're not painting communities with the same brush, but actually allowing ourselves to be way more strategic and intentional in terms of bringing an equity lens into the conversation. The second topic that I believe we also need to get better at is mental health. So much of the literature, the conversation, the analytics that correlate health and built environment focus on physical health and on active lifestyles. And that's great. Like, we need to get people to go out, do more exercise, walk more, do all of these kinds of things. But we're only really scratching the surface on elements of mental health, social well-being, socialization, and many of these other elements. One of the silver linings of the pandemic, in my mind, has been the complexity of the conversation getting richer relative to mental health. So just picture any article that has been published, and this particular image comes from Maclean's magazine, an article trying to figure out the notion of letting people out into the parks under the premise of mental health, right? In order to be able to support their mental well-being. 10 years ago, it would have been entirely based on doing more exercise and just physical activity. The conversation is getting more complex, and we're starting to have some of those conversations, right? This is, again, infographics coming out of the UK promoting, and 10 years ago, this infographic would have been entirely based on physical health. This one is now starting to be on mental health. Get out, walk, because it's good for your mental health. These are good. We're starting to talk about it, but we need to do, as an industry, a lot of catch up in really being able to understand some of these correlations. How do we start to really build an understanding, the data that is going to allow for evidence-based decisions, and then to get that into decision makers and planners and architects and the likes. This is now just recently the province of Ontario, where I live, imposed further restrictions, but which I love. So the header says Ontario extends emergency orders to keep people safe. The tagline is some outdoor recreational amenities open, remain open, and it's entirely on a mental health basis, which I think is really interesting, because it means that, again, that conversation is becoming a little bit more complex. The third topic that I thought we would touch base on is one of really kind of starting to understand the agency that people play in their own health and well-being. Often, as researchers or analysts or decision makers, we end up in a position where we end up making choices and decisions on behalf of somebody else. And we know that if people are really going to improve their health and well-being, agency matters, right? A definition of community well-being that I'm sure you're all familiar with is the one that's on the screen. This is the one that New Zealand has adopted, that we adopted in the community well-being framework. Many others have adopted this specific definition. But I want to highlight one element in there, and that is the notion of recognizing that individuals and communities need to be part of making the decisions around how their health and well-being is going to be improved. So if I just go around, wagging my finger and telling people they should lead active lifestyles, right? Or your kids should walk to school, or whatever it is, very little is going to happen. But if people really understand and are part of making those decisions and take agency over that, it can completely change how we come about and really transform environments. And certainly we've seen that happen multiple times. This is an image of public events. Many of you have been in many of these public events, but instead of doing a survey that basically kind of collected data on usage, we were asking people how they could plan and build their cities into the future based on the indicators. So as an example, we know that rates of volunteerism, communities with high rates of volunteerism have strong social networks, social capital. It supports mental health, the isolation of seniors. A lot of good things happen, right? So the question was to the community is like, how do we create opportunities for volunteerism? And guess what? Great ideas came out. They developed all kinds of things. So the ideas were tracked against the indicators, and then the plans developed. So in any case, kind of close this by asking really the questions back to everybody, knowing that the industry and these conversations are getting more and more mature as we continue to advance, is how can we respond to the important calls around elements of equity, on elements of mental health, and how can we bring some of the decision-making and the capacity and even the advocacy for what we're talking about to the hands of people who are going to be taking responsibility over their own health and well-being. Anyway, more questions than answers or any in it, but I'm just posing it out for everybody to talk about. Thank you.
Thanks, Antonio. Cory, over to you.
So I was asked to talk from a perspective of public health and applied public health. The Urban Public Health Network, for those of you who don't know, is a network of the lead medical health officers from the largest cities in Canada. We also do a lot of collaborative work in our research and reports with the Rural and Remote Public Health Network and Public Health Physicians of Canada. So I thought I would just spend a couple of minutes first just letting you know about some of the things that we have already done. And as a partner agency, many of the people we work with in applied public health at the universities in our individual cities with city planners, et cetera, have certainly utilized the Canoe platform already. And some of the reports that we've done in the past number of years related to topics that would be of interest or include the Healthy Canada by Design projects, 2 phases that we ran in most UPHN cities, looking at issues of built environment and environmental health. This was an interesting project in that what many of us took for granted as ways that public health and urban planners should be working together on an ongoing basis wasn't true in many of our cities across Canada. And what we found was just certainly the topics that we worked on around urban design for health and well-being were of interest and generalizable, but a big legacy out of this was just the introduction that was made in more cities toward public health and our city planners working more collaboratively together in more cities across Canada. And that has left a strong legacy over time. Also, we share a lot of best practice ideas, and one example in the past number of years were efforts in various cities to resurrect the healthy cities concept and how we were working more in partnership with not just municipal government, but many of the NGOs and more from an intersectoral policy perspective, both in municipal government and provincial government, toward common goals on improving health and well-being in our cities. So there were some very innovative practices that certain cities were using that we've tried to now get going in other places. One way that we did that was through the MUSE project, or Multisectoral Urban Systems for Health and Equity, and the linked THEPA study, which was looking more at both government and decision maker perspectives and citizen perspectives on programs and policies that were somehow related to targeting healthy eating and physical activity from a design perspective or from a built environment perspective. So getting that kind of local data that can be used in planning to see essentially a baseline of where we at around awareness and support for these kinds of changes, and then how do you build on that through knowledge translation and through social marketing means to improve public awareness and acceptance, as well as political will. More recently, we've had a Healthy Cities research training platform proposal that's submitted. A number of the members that are on that proposal, and including Canoe as a partner, are here taking part today. We're really hopeful this will get funded. We'll hear next month, but the concept is this idea of linking the research community and training up and coming new researchers in a way that sets them up for that future that we're talking about today. What are those up and coming challenges with healthy cities that we need to make sure researchers are being given the right tools, if you will, to be able to act on those complex questions. And in part doing that by proposing to have internships within city planning departments and or public health units in these cities, so that they're actually working on the real world applied problems within these cities using some of the new tools that we're talking about here today. So we're really hopeful that that will come to pass. And if so, the access to these kinds of data resources that we're talking about today will be critical. And then, of course, as the Network for Public Health in Urban Centres in Canada, we have tried to provide a lot of input into public health reports that have come out of both provincial and federal public health agencies. I'll show you an example in the next slide with a built environment report. And of course, to inform the Canadian Institutes for Health Research Institute of Population Public Health Healthy Cities Initiative. This was just an example of the report from a public health perspective, federally looking at what needs to be done to improve health and health equity in Canadian cities. And certainly as you look at these really do represent the public health priorities that we have. And as we think about ways to build on the existing Canadian networks that we have, both data networks, research networks, practice networks, we need to think about this from a pan-Canadian perspective and applying the best practice we're hearing about elsewhere to the Canadian context. Many of the themes that you see here have already been talked about by our previous speakers, so I won't spend more time there. And I'll just give you a bit of an example from our 2019 meetings and the type of presentations that were done from UPHN members of issues that I think would resonate with this group today. When we were meeting in Quebec, we had a lot of great local examples of the use of health impact assessments to change or influence development within different Quebec cities, as well as investigations that were occurring when problems have occurred with environmental health due to urban issues. Several cities presented on their local climate change plan and how they're working together with city planning on a response to climate change, both for turning things around and for mitigation activities. Many others presented on their planning around how to deal with heat islands in Canadian cities as an example. And then, of course, looking at health impacts on vulnerable populations from various types of urban redevelopments going on, presented by our Vancouver colleagues as an example. Recently, some of the priorities that we've been talking about at UPHN relating to urban built environments has already been talked about. CIHR Healthy Cities Initiative. We've partnered with them and letting them know what some of the priorities are for local public health and city planning. That has had some influence in the types of funding opportunities that have come out. There have been a variety of collaborations, both with research going on with Canoe as well as organizations like CAPE on implications of climate change in urban environments. A lot of discussion about these types of issues at the Global Health and All Policies Network, which UPHN is a member of, and now is being hosted globally by our partners in Quebec. We also do a lot of research on measuring trends in health inequalities in Canadian cities and looking at that from a different perspective. I've just got a little picture there or screen grab of our latest report that you can find on our website. But really what it talks about there is how there's a lot of variation about the degree of health inequalities in Canadian cities. And we're now digging into more what's behind that, the drivers for why there's such difference in the level of health inequality. Most of it is due to differences in the health of lower income neighborhoods rather than much difference between cities at the higher income level. And then, of course, has already been talked about, the COVID response, both in terms of direct and indirect impacts on health equity. I've got a link there at the bottom to the Chief Public Health Officer report on From Risk to Resilience, an equity approach to COVID-19. But we've certainly seen, as has been shown by the previous speaker, the issues around urban environments in making COVID worse in highly dense environments, how that's led to inequitable disease, hospitalization, and death in vulnerable populations. And the report that I link here to points to issues of certainly poverty, but the associated then crowded living conditions and conditions in shelters, often exacerbated by poor ventilation, including the crowded conditions on public transit and inequitable access to green space and difficulties in maintaining physical distancing in those crowded environments, including sidewalks. People probably saw the video that somebody made of actually wearing a hoop that had a 2-meter distance around them, and just the difficulty in getting around in a downtown urban environment, trying to maintain physical distancing. So lastly, just in terms of future priorities that have canoe linkages, just in the last couple of minutes here, I just wanted to say that we're talking a lot about the adaptation of health impact assessments for actually health equity impact assessments on city plans. One example you can see on our Saskatoon website of a health equity impact assessment on the city growth strategy. A lot of need for diverse data sources with that kind of approach. The integration of healthy cities, health equity, and sustainable development goals, as exemplified with the model I show on the right here, that was taken from the Copenhagen Mayor's document from a few years ago. Partnering with big city mayors on study tours on urban design with CIHR. They've been working with the 880 project and doing some funded trips where planners, along with public health and researchers, form a team and can actually take a time to visit in a city like Copenhagen and use their time there to do some joint planning on how to better design healthier cities in that context with some protected time. We've talked already about the urban response to climate change as an obvious partnering opportunity. One thing I thought you'd be interested in is our work that's going on right now on trying to collect together some of the local public health data of our partners in the UPHN in a pan-Canadian local public health observatory. And that's an obvious place where we'd want to link with canoe data sets and augment it with our health data sets rather than reinventing the wheel. So I'll stop there.
So we're running a little bit behind schedule, but I do think if I can ask Jeff to pick the key question out of all that were asked, maybe we can take a few minutes, since we've got the panelists here, to take advantage of their thoughts and expertise, and we'll ask Danny and the discussants to squeeze their time a little bit to let us have at least one good question. Jeff, have you picked a favorite?
It's hard to pick one key question, but a few things that come to my mind, and I really want to thank the speakers for really insightful perspectives you provide. They are really meaningful, and definitely paints a picture of lots of work that Canoe could do. So that really helps. I think it's great to hear about sort of the greater and greater recognition of mental health aspects. It's really good. And I was also struck by Antonio's talk about let's get right down to the grassroots here, volunteerism, and working locally and working up from there. And so with that sort of spirit, I'm wondering then from things like Mark's perspective, when he talked about interventions and some of the things they've been doing in Barcelona or other cities, Have you seen some of those have been sort of informed and sparked at that local level? Is there a connection there from the local to then what has been done that now can possibly be evaluated? Do you know what I mean about that connection? Maybe we lost Mark. No?
No, I'm here.
Okay.
Sorry, what the connection for?
Yeah, well, you know, you touched upon interventions and evaluation and some of the changes that have been made and the potential benefits. And then Antonio talked about, you know, the need to really engage at the very local level to, you know, find out, you know, really what's needed, what is equitable for a community. And, you know, whether or not in the activities you described, there has been that sort of deep level of local connection to sort of, you know, get what works best.
Yeah, I think it's also what is extremely important is working with the communities. I mentioned the super block model in Barcelona.
Yeah.
When they tried to introduce the first super block in Poblenou, there was an awful lot of resistance of the local population. There were equity issues, and you know that created a lot of anxiety and discussion. And it was kind of implemented in an area where probably not the best, there was no participation. And since then the city council with other groups, I mean, they for the next super blocks they started with the participation, and so we've now got a very big participatory process ongoing where there's a lot of input from the local population and what it's going to be. I mean, for example, from our point of view, you know, it's very nice, the super blocks. I mean, imagine living there. I mean, you don't have any cars anymore in front of you in the middle of the super blocks. You got more green space or whatever. But yeah, what the planners found out that people think it's nice to live in the middle of the super blocks, but they don't want to live on the outskirts. I mean, so, and if you have this clear cut from your in out, I mean, that's difficult. I mean, people don't want to have that. So now with the new super blocks, there is not a clear definition if you're in or out, and it's becoming a bit more vague. And so these are some of the changes that are being made. The rest of the, you know, for the others also, the population is very much involved, deciding what's going on. There are experts talking, and so it's a long process. Unfortunately, that slows everything down. I mean, this is going to take years, but I think we've seen a lot in other cities here in Europe as well, where we have similar processes ongoing, where the whole community is involved. And we only know that changes can be successful if the communities are being involved and, you know, give their approval. And, you know, sometimes it comes down to very simple things that people think that they have to lose their car or can't park their car outside anymore. What very straightforward in a way to deal with, but also much more complex issues. And I think there are many good examples around at the moment, not always well documented, I must say, in the scientific literature. And I think that's a problem. I mean, we've seen now, if you look for the super blocks in Barcelona, there are a number of more scientific evaluations where you can find back, but that's not always possible for many evaluations.
Yeah, I mean, the evaluations could be, you know, really detailed and integrated if you thought in advance. You know, that's helpful, and you know, it is difficult, and that sort of leads to one of the questions that we got, which you sort of painted the picture of the challenge between the people not really thinking they want it, but then some seeing it was valuable afterwards. So there's a good question from AJ Ray about, you know, where is the disconnect between sort of the whole process that has to take place to bring in a change? You know, so, you know, where are these barriers being erected? Is it in the health knowledge to the built environment professionals, or is it between those professionals and the decision makers, the elected bodies, or is it between the public and maybe those decision makers? Is there sort of one key barrier where maybe it's greater, or really is it just that all of them need to talk more? And that's open for anybody to, you know, comment on that.
I mean, I would love to start off with that, because I think we need to talk more. We're getting so specialized. We're so much in our little silo, and, you know, unfortunately, everyone is so busy, doesn't have any time. And actually, you know, to do it together takes an awful lot of investment and time. That's what we're finding, and often we're not willing to spend that time and investment. And I think that's one of the big barriers. Unfortunately, most of the time the intentions are fine. But anyway, Antonio has got his hand up. Sorry.
Yeah,
no.
That's good.
Sorry.
Thanks, Mark.
And I can also jump in, and I'm sure we all could for hours and hours. But we all talk about the power of data, right? In my mind, data is only powerful if it actually has the ability to influence decision making, right? If it has the ability to come in at the moment when city council or a community or somebody is trying to make a decision on pieces, and it's not going to be, you know, the high echelons of any kind of government that is the single place where decisions are made. People are making decisions all the time. Where do I buy my house, right? What kind of neighborhood do I want to live in? And we've experienced instances where data is already informing those kinds of decisions, right? So you hear communities talking about walk score, right? And they check the little website and they check the walk score of their neighborhood, and you're seeing how this data is starting to inform the day-to-day choices that people make. Carbon footprints are starting to make, that information is starting to make its way into day-to-day discourse. So I think that, you know, one of the challenges for all of us is to reduce the barriers between what is the data we're choosing to collect, how do we collect it, how do we disseminate it, and what are the gazillion environments where decisions are being made, big policy or day-to-day activities, so that we can make sure that that information is making its way into advising and bringing evidence into the decision-making process.
Mm-hmm.
But I'd love to see like the little neighborhood group talking about their park and thinking about health and well-being about things. Like, it's not just government that has to do it.
No, you know, then and it snowballs hopefully from there. Cory or Esra, have anything they want to add on that?
I think we're going to have to pinch it off, unfortunately. It's obvious there's no one-size-fits-all solution, I think.
Well, yeah, and I think that's sort of the challenge, right? It's not one size fits all, and there's sort of competing directions that maybe the data will suggest, and then, you know, and then maybe gets conveyed as uncertainty or ambiguity. So then those who make the decision just forge ahead. So I guess finding the path where you use the data to the maximum potential, you know, knowing that there's, you know, limitations. And, you know, one of the big comments that came up in our survey was around the pressure for densification, but not really fully knowing, you know, what does that mean in terms of the health implications, you know, in a very broad sense, and to then, you know, follow that path. So maybe we can pick up on these some more later, but let's move to the next step.